Hello, everyone. My name is Dr. Timothy Brown, and this is another episode of Protecting the Vision, where we share educational information on a monthly basis to give information out to the public, to the communities, to educate those who are maybe in underserved, underrepresented communities with information from our guest speakers. And we're going to have a great guest speaker who is going to speak on the topic of eye and ear awareness there. So stay tuned. She's going to share with us tonight, and I'll introduce her in a few. But before I do, I would like to just take the time to introduce who we are as an organization there, as a foundation, the National Optometric Foundation. We're the financial arm for the the National Optometric Association, the NOA. And we support the National Optometric Student Association as well by scholarships, supporting them while they're in optometry school, trying to provide finances to help them get to conferences, to conventions, so that they will be exposed and have the opportunity to be around like-minded people, be around doctors who look like them and people who are thinking like them. And we also try to support communities. We partner with the NOA each year at the convention to help provide free eye exams, and partner with sponsors like VSP, where they provide frames and lenses on site for patients who come to those free eye exam events that we have. It's Serve Where You Go. And this year, the NOA conference will be in Ohio. That's right, Columbus, Ohio. We are on the way in July to do service in the community as well. We like to continue to educate communities, support the community leaders. If we have the funds, we like to provide funds so that communities can get the resources that they need, the education that they need. And we so glad that we were able to do that in the past with some of our community leaders. We want to continue to support students who are thinking about going to optometry school. They're currently in high school or they're in college, and some of them haven't quite decided what they want it to be in life. We want to encourage them to look into the field of optometry and consider that as their choice. So we want to support them while they're in school, and we want to continue to do what we can to raise awareness about silent killers of the vision. Diabetic retinopathy, glaucoma, hypertensive retinopathy. The NOA does a great job campaigning and driving this. And we want to also make sure that we are thinking about children, making sure that they're getting their eyes examined. Parents, you're listening to this tonight. We want to encourage you, don't delay. Call an optometrist, your local optometrist, and schedule your child's eye exam. Perfect timing, especially if you're catching a break right now during the summer. We can go ahead and get them in the office, get their eyes checked to make sure nothing is happening with their vision. Health-wise, making sure disorders, if they are there, they're detected, and we're able to manage and treat these things early on. Parents, you too need to schedule your eye exam. So don't delay, do it today. Find out more about the NOF and the NOA on our website. We have a website, www.nationaloptometricfoundation.com. We're also on Facebook under the same name, National Optometric Foundation. We are also on YouTube. You'll have great webinars, as you're going to witness tonight, that you can go and watch and share with your family, friends, your church members, so that they too can have the wisdom and the education that our guest speakers have been sharing with our listening audience for a little over 3 years now. I'm so excited to be a part as a board member with the National Optometric Foundation, being a director of education and driving these webinars forward. We'll continue to do what we can to educate communities, to support the National Optometric Association, and to support our great future leaders, future optometrists, the National Optometric Student Association as well. If you would like to donate and allow us to continue to do the great things that we have been doing for years, we do have a Cash App, and you can donate tonight. $ Protecting the Vision is our Cash App there. So continue to stay tuned. I am going to do my very best to introduce our great speaker for tonight. Fabulous, great speaker. I've been in touch with her. She's been growing over the years, and that will be her story to share with you. I just want to let you know that she earned both her bachelor's and master degrees from Nova Southeastern University in Florida, and will be starting audiology school this fall. Her interest in audiology began with a fascination for how we hear and we communicate, and it has grown into a deep passion, allowing her to be there to help others, especially pediatric. She loves helping children, enhancing their quality of life, through better hearing care. Long term, Christy was planning to open her own audiology practice where she could focus on pediatric care. She's especially drawn to working with children and their families to ensure early intervention, personalized support, and compassionate service during critical stages of development. Outside of academics, she enjoys exploring new restaurants. Oh, we can go eat anytime. Good, yes, new restaurants, discovering unique places to eat. Food is fun and a social way. It allows her to unwind. Great job. That we all need that mental break. She's also committed to giving back through volunteer work, as serving the community is a core value in both her personal and professional life. She's excited for the journey ahead, and you should be, Christy, and all the opportunities to grow, to serve, and make a difference in the lives of others. If you would, put some love down in the chat box. Give a round of applause inside, wherever you may be, for our great guest speaker for tonight, Christine Woody. Come on, Christine. We're so glad to have you here with us this evening on this webinar. I'm so excited that we're connected. The National Optometric Foundation, we are honored to have you on sharing with our listening audience. Welcome to the show.
Hello, everyone. Thanks for having me, Dr. Brown.
You are welcome. We are so glad to have you, and we're excited to learn more about you, learn more about your journey, because your journey has been growing. You've been growing from different locations, and now into the optometry world, and you're into the audiology world, and we want to hear about those worlds and how they're coming together for you. We want to learn more about you. So just starting out, I want you to just, if you would, Christine, tell us a little bit about you so that we can get to know you a little bit better.
Hello, everyone. My name is Christine. I'm a mother, a future wife, and a loving friend. Like many others, my path into the healthcare world is non-traditional. I graduated high school 17 years ago. Oh my God, I feel old.
I won't tell you how long it's been since I've graduated.
And I didn't go straight to college. I didn't see that in my family. I am a first generation graduate. So I navigated through different jobs for many years before landing in the world of optometry. I worked at Walmart and won Cashier of the Month for 3 consecutive months. And that was when an opportunity was presented to me that would change my life. My store manager, Denise, approached me and said, Christine, we have an open position in optical as an optometric technician, and you will be a great candidate for that position. I replied, an optometric technician? What is that? She replied, no worries, you will be trained. I interviewed and I landed the job. No matter my job title, I always gave it my all. That was the first time I was introduced to the world of optometry. Fast forward, I wanted to become an optometrist. I researched and found that Nova would give you financial assistance if you were a full-time employee. I applied to Nova and became an optometric technician in 2019. In 2020, I started my career journey, enrolled in school, and started my path to obtaining my bachelor's. I balanced being a full-time mom, full-time employee, and a full-time student all at once. It was not easy. It was so hard. But nothing worth having comes easy. While working at Nova, I became the clinic ambassador for 2 years in a row because, as I mentioned, a title did not define my character. I always did my best no matter what job I had.
Wow. Wow. That's incredible. Denise was there when your life was transitioning. She pushed that transition in front of you. You accepted that position, applied for it, and boom, got the position. Wow.
Yes.
Look at God.
Won't he do it?
It's amazing. It's amazing. It's amazing, and that just speaks volumes, with the information that you share. You have, greatness within you. They're recognizing you for 3 consecutive months as cashier of the month at your
Yes.
job there. It takes a lot in that environment for someone to keep the character that they need to earn that recognition as cashier of the month. So we applaud you. You don't take things for lightly. A lot of people take things for granted. I don't. I try to listen and understand and give recognition when it's due. So that's really great. And then talking about your role shifting as an optometric technician that you had no clue about.
No.
You knew nothing about the position, but you accepted the invitation, and they provided the training for you, and it has landed you in a position where you will tell us later on how that has allowed you to be connected to so many people and resources, and then you yourself being a resource for others, in the world of optometry, and then now audiology as well there. So, but tell us a little bit about your role as an optometric technician. Just you in general, just thinking about when you first enter that world. How do you feel? Who do you work with? Was there a doctor that you were working with there? Just give us a little insight on that. If you would, please.
It was definitely different because, like I said, I was a cashier. So all I had to do was just ring up groceries and put them in the bag. So it was different to learn like medical technology terms and the equipment. It was so different, but I caught on fast. I enjoyed it, helping patients from a different perspective. I worked with like 4 doctors and like 3 different other techs, but I only worked at the front desk, so I didn't get the experience of the equipment and everything until I started working at Nova. But it was amazing.
Yeah, but that opportunity, even at the front desk, gave you the opportunity to be able to interact with people, customer service there. And I'm gonna go back to something that you said. You said all I had to do was ring up groceries and put them in a bag. No, you did more than that. You had to greet the people. You had to speak to them, smile, service them. I know you did more than just scan products and then put them in a bag.
I did more.
Yeah,
People would
because
literally wait in my line. Like the other lines would be empty. They would wait in my line just for me to bag their groceries. I'm like, what am I doing different? I ain't doing nothing different.
There you go. See, that's what I'm talking about. I have to pull that out because I know you can't get cashier of the month for 3 months in a row, and all you're doing is just grabbing some products, scanning them, putting them in a bag. There's got to be something that stands out when it comes to Christine Woody being behind that register there. And I wanted you to just, make sure you talk about it because that's a part of who you are. That speaks volumes about you as a person and how people were willing to wait in line, even though there were other lines that were shorter. They were waiting in line in order to see you and be serviced by you. So that speaks volumes about
you.
Yeah. So good having that there. And then your experience now has taken you to Nova in Florida. I think I passed Nova on the way coming back from Miami last week there. But having that opportunity to get to Nova put you in touch with faculty. It put you in touch with students. People from different backgrounds, which brings in another learning opportunity because when you have to work with people, you always need a little bit of patience there as well.
Yes, a lot of
You
patience.
know, so yeah. So talk a little bit about your experience there with Nova, working with faculty, working with students, and how that's impacted you as a person.
Working with the students, it gave me like insight how graduate school would be. So like, I became friends with the students. So they would tell me like how to decompress when you have hard days, testing days, exam, clinical, like, so that part of the aspect was amazing for me to gain friendships with them. Working with the faculty, it was amazing as well because I see beyond just giving eye exams. They made
Yes.
friendships with patients. It's just amazing. It gave me the opportunity to see both ends of it. So what I would be doing as a clinician and also as what I would be getting into as a student.
And you mentioned about taking the pathway of working with not just adults, but working with the little people for us there,
Yes,
the pediatric care and everything.
yes,
You have a passion for that.
I really do. I attend different health screenings with one of the doctors, Dr. Faraz. Also, I just did one with Dr. Reynolds as well, and I enjoy pediatrics. Like I feel like I have that spirit to connect with those little people.
Right. Right.
Yes,
And it takes special people to work with other people's children.
it does.
Working with pediatric takes a lot of patience. It takes the right voice, and guidance. All of those things are important when you're working with pediatrics. You can scare them or you can excite them. You can draw them to you or you can push them away, all based on how they perceive you. Your
Yes,
personality, all of that is important when you work with pediatrics. We do a lot of work with children at Insight Family Eye Care, with my wife. And we actually work with some today. And all of them had a great experience. Some of them come in, they don't know what to expect. It's their first eye exam, they have no clue. But when they are under my watch, I try to put them at ease. All of their fears, all of their doubts, I try to make those things just go away and erase for them. And that's the care that children need. And not everybody can work with children. So for you to have that passion for working with pediatrics, I recognize that. And I want to applaud you for that as well, because that's needed. It's needed not just in eye care, but it's needed in ear care as well, for audiology as well there too. So continue to keep that. Don't leave them hanging. Not a lot of people, take time to slow down and work with children. Okay, so make sure you do that. And the goal of I think you talked about doing some drives as well. You did some drives as well.
yes.
Tell me a little bit about those. How did that go for you all?
So every year after COVID-19, I would attend the back to school drives that Nova hosted with one of the doctors, Dr. Faraz, and that is when my passion for pediatrics formed. Being from an urban community lacking resources, it took me back to my childhood when I didn't have the resources to get an eye exam or even a vision screening.
Wow.
And vision impairment can significantly impact a child's learning
Yes.
ability, affecting their cognitive, social, and physical development. Children with visual impairments may struggle with academics, tasks like just basic reading and writing, and, uh, and attending to visual cues in the classrooms. This can lead to difficulties with comprehension, test scores, and academic performance. I have also participated at the NOA, the National Optometric Association, for 2 years, and the AOA, the American Academy of Optometry. And
Mm.
while at the AOA, I attended a neurology workshop, which I gained a lot of knowledge and insights into diagnosing and managing common neurological disorders such as a stroke, headache, and movement disorders.
Wow. And it's amazing that you bring your personal experience there. You're transparent, talking about the lack of access to the resources to get an eye exam. And that's something that people are still struggling with today. And that's why I thank God that the NOA, the National Optometric Association, was founded in 1969 with the mission to serve underrepresented and underserved minority communities, people who don't have that access to healthcare. More organizations are needed, with that mission at heart and at mind, and for that to be a passion for them there. The NOA continues to provide free eye exams in different communities, all around the USA, wherever the convention is going to be. They are there, serve where you go. They got their boots on the ground. I don't know if they're going to actually do the dance to boots on the ground, but they're going to have their boots on the ground in Columbus, Ohio, doing free eye exams coming up in July. And we also, because you mentioned going to the conferences and everything there too, but they also, the NOF and the NOA, we strive to help students get to those conferences as well, because we know that the exposure is good for you as students. We know that the networking with doctors, being able to see people who look like you, being around in a group of people who are thinking like you, we know having that access to education and being around peers, networking with peers, that's in other optometry school, how vital that is for the growth of students transforming into eye doctors as well. So I'm glad that you got that opportunity to be able to attend some of the conferences there, and you got exposed to all the things that you were able to be exposed to as well. Let me just take a look here. You got some comments here on YouTube. We want to see Ms. Thompson is saying, hello, Christine. Dr. Reynolds is saying, I'm proud of our future Dr. Christine Woody. Okay. We got Garnell Campbell that's saying, hi, Christine. I'm so proud of you. Look at there. You got a fan club going on here. We got Queen Portia saying, I'm so proud of you, Christine. She always go over and beyond. Wow. See what I'm saying? Have greatness within you. People recognize that, and that's great, just to see those comments coming through there on our YouTube channel. Yes, Dr. Reynolds is also a great person. She's a great mentor, a great doctor, a great colleague there. Dr. Clever, Jacoby Clever, is saying, way to go, Christine. Yeah, that's good. You got a fan club going on. And then also we got Crystal Marie, and she's saying, go, Christine, saying you're the best. Adelda Blanc. Wow. Okay. Stephanie said, I see you, Christine. Okay, y'all, thank you. Thank you all for the love. I want to just take that time, because it's important for our guest speakers to know they have the support of the community, the support of family and friends, and their message that they're delivering inspire other people, providing education. That's why the NOF continues to do these webinars, to bring people together, to connect them together, to educate communities so that no one's lost. We want to help protect the vision. Christine is going to later on tell us about audiology as well. We want to help make sure that we are not having people going continuously not getting their hearing check as well. So this webinar is going to focus on eye and ear awareness there, and she's just sharing a little bit of some insights in her journey, how she got optometry and how she got audiology, and we're so thankful. So shout out to the fan club for Christine Woody. That's all right now. Now look, speaking of Dr. Clever there, I know that you came in contact with him. We were in optometry school together. He was a class after me, and also one of my colleagues, Dr. Essence Johnson, was also with me in optometry school. She was actually my vice president of our optometry class. And you were able to connect with them. I want you to tell me a little bit about your connection with Black Eyecare Perspective, because you're the president right now of Black Eyecare Perspective, and you guys actually had me involved with the webinars on there as well. So just tell us a little bit about how you were first introduced to Black Eyecare Perspective, and a little bit about the great people who you work with there.
So I was first introduced to Black Eye Care by Dr. Reynolds like 4 years ago. I think it was 4 years ago. And now I am the serving president. Um, Dr. Johnson and Dr. Cleaver, they are like the best. We can like call them for anything, no matter what it is, personal, education related. They're always a listening ear. They're always there for us. The Black Eye Care Perspective, it's like a whole world of different optometrists and upcoming optometry students that look like me. So it was like a breath of fresh air to have that safety net, to just see so many people like you, so many like-minded people like you. Because like I stated before, I'm the first generational graduate, so I didn't see this growing up. So just to be in a community with so many like-minded people is such a breath of fresh air. And I plan to bring that into the audiology field. Like, just be that voice to let people see, like, if you see it, you could be it. As Dr. Johnson's favorite little line, which is
Wow, I like that.
true.
Wait a minute. Wind that back and say it again for the people in the back. Say that one more time.
If you see it, you could be it.
All right. Look at that. Yes.
So that's my goal. That's my long-term goal as well, to just form an organization just like BPOC, but into the audiology field, because it's not many of us in that world. It's less than optometry.
Wow. Wow. There's a need for representation. I
Yeah.
had Dr. Adams on the webinar at one time, and he shared about the need for representation, being seen, being recognized there. So the need is there for optometry, and now you're telling us the need is there for audiology. So the optometrists surrounding you didn't keep you in the bubble. It did not keep you in the optometry bubble.
No,
You
they
found
supported.
you found a sharp pen somewhere and you popped that bubble and you squeezed out through that little hole and you decide to explore the world of audiology. Talk about
Yeah.
that transformation for me as well.
So one of my professors, Professor Alina Perez, she works in the healthcare science department at Nova, and she
Mhm.
invited me to a symposium. It's called Sophia, South Florida Institution of Aging, Think, Act, Thrive. And at that symposium, like, it was amazing. They talked about how audiology is going to grow within the next years. It will increase 19% through 2032 due to like headphone usage, everyone's aging. And I just got interested in it. I did my research. I started shadowing the clinic. And I was like, I could bring awareness to this field and also help. Like Dr. Johnson always say, if you see it, you could be it. So just go back to the urban communities and talk more about, being a doctor. Because in my high school or middle school, all we saw was nurses. And we think like if you were a nurse, you made it. Like, we need nurses. There's nothing wrong with nurses, but we could stretch
Absolutely, we need
beyond
that.
that. So
Yeah.
that's all I want to do, is just bring awareness to my community and let them know you can go beyond nursing.
Yeah, shout out to all the nurses out there. We do need you.
We need
Sometimes you
y'all.
do you do a lot of work, in your role as a nurse, and sometimes the patients are with the nurses longer than they are with the
More than the
doctor.
doctors.
Exactly. They're there with that care all the way around. I've been in the hospital as a caregiver, with my mom, and I've seen the work that nurses do there as well. There are some roles that's essential as we continue to care for the community, continue to care for people. And that role in audiology is going to be a great role for you, because there are other young ones out there, male and female, who are going to be inspired when they see you, Dr. Christine Woody, standing before them, as you go back into those areas and you speak to those students there and you share your journey and your story with them. That's going to be great, not just for your household, not just for your family, but for other families that's in different communities as you continue to give back there. I always tell people, find a way to give back. There's so many opportunities out there for us to give back, for us to slow down, to lend a helping hand, to be a mentor to someone else there. We invite people into the office who want to shadow so that they can be inspired to go into the field of optometry and see themselves in that field and in that position as a career choice for them as well. So we always have the opportunity to be able to give back to the community there. And so again, let me just go over here and see the comments are still coming in for Christine. Thank you guys. It says Lorna said you are amazing. So that's a great thing there to see. And you know, there's other things out there that people are saying there from Crystal and from Stephanie. Thank you guys for the comments there supporting our guest speaker. As she continued to tell us about, you were talking about hearing impairment and your pivot to audiology there as well. How is vision and audiology tied in together? How are they related?
Hearing and vision are related because they impact how we perceive and interact with the world. Both senses contribute to spatial awareness, balance, and communication, with hearing enhancing visual perception and vision assistant in understanding auditory information. Age-related declines in one sense can also affect the other, and certain conditions like Usher syndrome affect both simultaneously.
Yeah, and I know just like in optometry, people probably don't get their hearing tested. You know, once you go through those screenings at school, you raise his hand. If you hear a beep in this sound, you raise his hand. If you hear a beep in this ear, once people go through those screenings, I'm not sure that they get checked anymore.
No, they don't. Not in the school system.
Not in the school system. What can we do? What can we do to improve screenings or trying to get people into clinics, you know, to get checked? Is there something that they can that we could do as a group, or is there something that our listening audience, you want to encourage them to do as well when it comes to their hearing care?
Schedule an appointment to the audiologist, especially for the younger kids, like the pediatric, just to help them, because sometimes kids, they don't understand that they can't hear. They just listen to the iPad extremely loud or the TV extremely loud, and that's how you know, like, it's something wrong with their hearing. They need to get it checked. So mothers, aunties, uncles, if you hear your family member listening to anything extremely loud, that's a sign that they need to get their hearing checked.
Wow. And you mentioned it earlier in your talk there about the increase of hearing impairment because so many people are walking around with the headphones on and everything. That's pretty much, you know, what we're starting to see. It's a trend that we're starting to see. I mean, I was on vacation and both of our children, you know, on the ride, you know, down, they had the headphones on. You know, so we as parents, what we need to be mindful of is what you're saying is the volume. The volume. Correct. It's not so much that they're listening to something on their ears, but you're saying the volume. Is that what they need to be aware of?
And take breaks. Take breaks. Don't wear it for long hours, period of times. Take breaks. Take it out your ears. Give your ears a rest. Even with the screen time as well, parents, that's very important for your children. Give them breaks.
Okay, so there you go. Take breaks just like we do with the digital devices. There, we encourage them to avoid eye strain because of the long use of computers, iPads, cell phones, protecting the eyes. You wear glasses, put the blue blocker, blue filter on there to prevent damage to the back of the eye, the retina, blocking the blue light that can cause damage to the retina. She's also encouraged you to take breaks when it comes to listening to things for a long period of time, you know, being locked into what I feel is a box, because some of these things are like noise canceling and you can't hear what's going on in the rest of the world. So I feel like you're kind of locked into a box there. when you have the headphones on all day. Are there organizations that you're connected with or that you're learning about who could be a resource for some people who need to have their hearing checked, or if they need any assistance? I don't know. I'm just asking the question
Not yet.
to see.
I'm sure when I
Okay.
start school and get into that world, I'll know more about it because I'm so
Mhm.
locked in with optometry right now.
Yep, yep, yep. And the world of optometry, even with that, you mentioned your journey with the you said the AAO, the AOA, the NOA. So your journey with organizations like that has helped you get those stepping stones that you need as you're moving into the audiology world. There are those connections that you've been building in optometry will be also beneficial to you when you get into audiology as well, because both professions, their goal should always be to try to prevent things from happening to people. Just like we tell people to get their blood sugar checked, stay in touch with their primary care doctor, make sure that diabetes do not cause them to lose sight. One of our silent killers there, making sure that they're getting checked for macular degeneration, glaucoma, hypertensive retinopathy. There will be things that you will discover in the audiology world that you will need to make sure that we're educating people about. So maybe around your second, third year, you can give us a shout out, and we can get you back on so
Yes.
that you can give us some more in-depth information about the world of audiology as well. I think that's crucial to our listening audience there. So maybe in 2027, you can
Yeah,
come
that'd
back
be
and be on
great.
a guest speaker as well, so that we can get some more information about audiology there. Speaking of that, I would like to know if you have any information, because I have a little bit about some statistics when it comes to hearing impairment and things of that sort that you can share with our listening audience so they can know how critical it is for staying on top of not just your eyesight, but your hearing too, because they said many people don't get their hearing tested or treated, even though untreated hearing loss can be connected to other serious health conditions, and it can cause the quality of your life to take a
To go.
downward slope. This is why we want you guys there. We call this show Protecting the Vision, because we know when people don't go and get their eyes examined, they're not just missing out on getting their eye care, but sometimes your optometrist can detect things that's going on with your body, cholesterol, blood pressure, as I mentioned, diabetes, some of these things that you may not even have symptoms of, glaucoma. That's why we want to encourage you guys, don't delay, do it today, get checked, make sure that you don't neglect taking care of yourself. That's why I say, parents, if you're listening, we want you to get your children scheduled. We want your children to get an eye exam. We want them to go see their audiologist, get their hearing checked. But we also want you too to get in line and be checked. Don't forget scheduling an appointment for yourself. The Hearing Loss Association of America says they're the leading voice for millions of Americans, okay? And they said there's a big risk of hearing loss for people. And what we need to try to do is raise this awareness there, breaking down the stigma, and empowering people, educating people nationwide, providing that network of support to people. What stats do you have, Christine, when it comes to hearing impairment?
Over 1.5 billion people worldwide live with some degree of hearing loss.
Wow. What's
More
that
than
number again?
1.5 billion people
Billion,
worldwide,
not millions. Billions.
billion,
Wow. Wow.
living with
Wow.
some degree of hearing loss.
Wow. That's a lot. That's a lot. And they tell me that 50 million people, Americans, 50 million Americans, they have some type of hearing loss. And, so that breaks it down to being like every 7 person that you pass by, when you pass by 7 people, one of them have some type of hearing loss. They don't always break it down and say, what may be causing the hearing loss, but one of them have hearing loss there. So as you say, because of our trends and things that's happening, that number could increase there. So we want to be at the forefront. We want to try to educate people to let them know about that. And we appreciate you for being on here to just bring this awareness to our listening audience today there. Any other stats that you have that you want to share when it comes to hearing impairment?
Without action, this number is projected to grow to 700 million by 2050.
Wow. And we're right now in 2025. So you said in 25 years, that number could grow. More hearing impairment there. Wow. Let's see. Are you guys hearing this tonight? Those of you who are joining with us on YouTube, you here supporting us? Yeah, I agree, Crystal. We need that 20-20-20 rule that we use for optometry. We need that for audiology as well there too. Dr. Reynolds also saying ear health and eye health, they're connected. In addition to retinitis pigmentosa and Usher syndrome, tumors can be in the center of the ears and present with double vision complaints. How about that? Some of you who are listening, you wonder why when you go to us, we ask so many questions when it comes to you presenting double vision as one of your complaints, your chief complaints. It's because tumors can be connected to those complaints of double vision. You're absolutely right. Dr. Reynolds also saying, I'm just sharing this, Christine, your mentor, increasing awareness about the link to hearing in the eyes is so important. It is. Your overall health is important, as someone mentioned here, Ms. Thompson said. And there need to be more doctors in offices that are combining hearing and vision. I'm noticing that that's what they're trying to do in some of the commercialized settings there as well. They're trying to make sure they have an optometrist on site and an audiologist on site there as well. So having those things together, vision and learning, my wife often, she would do a PowerPoint presentation on vision and learning. It worked hand in hand. So we know that there's a connection between eye health and ear health there as well. What else you got for me, Doc, when it comes to any stats that you want to share?
Me, I have something else I wanted to say about hearing. When we at concerts, we don't at that moment we don't realize it, but even at concerts with it being so loud, it'll take an effect later on when we get older. That can cause hearing loss as well. And untreated hearing loss is linked to cognitive decline and dementia. So later on down the line, that's why some people has dementia from long-term hearing loss.
And it's funny that you mentioned that, because that was one of Jackie Davis' questions. Do you think that people with dementia can be helped by addressing possible hearing loss and vision loss? So that's another topic of discussion there. Just having people on talking about that topic there as well. Lorna would like to say that this information has been extremely helpful. She appreciates you for educating us tonight on this webinar, Protecting the Vision, as we talk about eye health and talk about ear health as well. As we kind of wrap up this session, if there's some information that maybe you wanted to share, Christine, and you didn't have the opportunity to be able to share it, the floor is open to you. If there are some words of wisdom that you would like to leave behind for our listening audience, you can do that as well. Some words of inspiration. I'll continue to look at the comment section and see if there's some things that people may want to put out there, when it comes to cheering you on and leaving comments about tonight's webinar, and then I'll bring those things forward there too. The floor is yours.
So if you have recurring infections or ringing in the ear or dizziness, it could signal deeper problems. Please do not ignore it. Do not ignore ear pain, fluid drainage, or hearing changes. Please see a healthcare provider as soon as possible, because it's deeper than what you think. My closing statement, I will leave you guys with this. Is my favorite Bible verse, Jeremiah 29:11. For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you a hope in the future. I have a couple of friends that's like applying for school. I know it's a challenge, it's a struggle. Hearing no or not yet, it's not a no. God's timing is always perfect. It's just not yet, not on his timing. So just trust him. Meditate on that verse. Just trust him. His timing is perfect. I thought I was going to do optometry. That's what I wanted. I kept saying I'm going to be an optometrist. But that's not what God wanted for me. He knew that he needed me in the world of audiology, like I said before, to bring awareness. So sometimes you got to just take a step back and just see what he wants, what's in his will. Thank you, everybody, for joining and listening.
Wow. Yeah, Christine just took us to church, y'all. Just took us to church. Wow. Open up the doors, man. Wow. God's timing is important, you know. The pathway and the plans that you have may not be the plans that he has for you. He knows what's best for you. Stay the course, keep the faith, guys, and trust the Lord. In all thy ways, acknowledge him, and he shall direct that path. There you go.
Amen.
Wow.
Amen.
This has been so good. I appreciate you for being our guest speaker, sharing with us today. I want to give a thank you to our listening audience. You know, you guys have been great making those comments show up down there for our guest speaker. We will definitely go back and read those on our YouTube channel for the National Optometric Foundation. I really appreciate you guys. Jackie Davis, Dr. Jackie Davis says, thank you for the shout out about the NOA server. You go. Yes, she got the dates. See, I can always depend on Dr. Davis, man. That's why she's the optometrist of the year right there. She got July, server you go. We're going to be in Columbus, Ohio. She got the dates down there for you guys. Doctors, technicians, we are looking for you guys to have your boots on the ground in Columbus, Ohio. We want you to be there to help serve the community, providing free vision exams and glasses to over 200 people. We want to do service for 200 people, so please come and help us out with that. Dr. Reynolds said you did a great job. Our future Dr. Christine Woody, you did an amazing job is what she wants you to know, and we want to thank you guys for being here to support on another episode. Christine, thank you so much for being on here with us. I hope that the rest of your evening is great. I'm gonna close out the show, and I hope that you will be back on here on one of our future webinars as well.
Thank you for having me.
Absolutely, I am thrilled. There you go, guys. Another episode of Protecting the Vision, eye health, ear health, some insights into the journey and the life of our guest speaker, Christine Woody. Her journey from optometry into audiology. She is the future Dr. Christine Woody Brown, and we are so proud of her. We are excited about the things that's going to come as she continues this journey, as she continues to surround herself with positive people who are there supporting her and lifting her as her mentor, Dr. Cheryl Reynolds. Thank you guys for being impactful in a positive way to those who are coming along. You can see that that impact helps our future leaders in this world. So the National Optometric Foundation, a nonprofit organization, we thank you. Thank you for being on this webinar. Learn more about us. We have a website, www.National Optometric Foundation. We are on Facebook, same name, National Optometric Foundation. We want you to go and like our Facebook page. Follow us on our YouTube channel where you can get this webinar and share it with your family and friends, as well as previous webinars there as we continue to provide educational information. If you would like to donate, be like our great sponsors that we partner with, people like VSP and so many others that I just can't call by name, but one day I'm gonna get that list together and I'm gonna get you guys all down there from the program what we have at the NOA conference there, and I'm gonna get all of those names out there. But we have a cash out, $ Protecting the Vision, to allow us to do the great things that we continue to do as the foundation, supporting students who are thinking about going to optometry school. They're currently in college. They're currently in optometry school. They're trying to get to our conventions. We give scholarships out as well. We are doing all that we can and some more to support our young future leaders. We are doing what we can as the foundation, the financial arm for the National Optometric Association, to educate communities, to raise awareness, to make sure we're campaigning when it comes to children getting eye exams and the care that they need early on. We do not want you to neglect our babies. Make sure that they're getting their eyes examined, because we know there are things that can slowly start to take your vision. And we know that vision and learning works hand in hand. We want to detect these things early on, give these children the care that they need so that they can do well in school. Adults, 3 silent killers. Don't let them rob you and steal your sight. Get checked. Don't delay. Do it today. Make sure you schedule an eye exam with your local optometrist. This has been great. I'm so happy to be on here as your host, Dr. Timothy Brown, board member for the National Optometric Foundation. I look forward to speaking with our next guest speaker in the month of July for another episode of Protecting the Vision. Until then, stay positive, stay safe, and people, continue to do the right thing.